The further we move past the height of the pandemic, the easier it becomes to trivialize the impact of the virus. Yet, COVID-19 stretches far beyond the last cough. Teamwork Inglewood sits down with Dr. Pendergrass of the University of Illinois Medical System and two Inglewood residents to discuss how COVID-19 has and continues to shape their lives, what is and how to recognize long COVID, and ways to access support in their journey to recovery. I am Brianna Hobbs, the Health and Wellness Coordinator with Teamwork Inglewood, and this is Understanding Long COVID.
Some people have very debilitating symptoms, right? There are people who just can't even walk across the room. Their shortness of breath or their fatigue is so intense, and that can cause that becomes a mental stressor, right?
February of 2022 is when I caught COVID. And it was actually through a friend. She was a host, a carrier or something, because my husband and I got instantly sick.
And when I got sick, and it was like, you all right? You got an upper respiratory infection. Then I kept getting sicker and sicker. My doctor was like, you have pneumonia and you have COVID. I'm like, huh? I just go to work and go home. I don't even go out to the stores unless when they first opened, it was like, well, maybe the child you were taking care of was a carrier, so I'll call the day. When I got it, I just believed what the doctor told me, that I had an upper respiratory infection. Then he was like, oh no, you have COVID, because I left work, physically couldn't breathe, and still drove myself to the hospital. And he was like, yeah, your test came back, so you'll be staying here. And when I did stay there, it was like 2 weeks, and I'm like, can I go home? He was like, oh no, you still have fluid in your lungs. And I'm like, oh my God.
The lockdown made it become difficult because my husband was working for the Cubs. He was catering for the Cubs and the players that come to the games. And because of the COVID, they had to shut the restaurant down completely. And so that left him without a job, and that's really struggling to try to keep up the mortgage and the bills.
We're still diagnosing COVID. COVID has not left. We're not seeing the same large influx of patients, but it's still there. And then more importantly, now we're seeing a lot of patients coming in with symptoms of long COVID. People can present with a wide range of symptoms, but usually what brings people into the emergency department or even to the attention of their primary care physician is the respiratory complaints and the chest pain, right? And so those symptoms usually last for anywhere between, up to about 2 weeks, 2 or 3 weeks. And then long COVID actually is when you have persistence of these symptoms, right? That last longer than that.
I had COVID after effects, as they call it, where I went through physical therapy. I went through breathing treatment with a respiratory doctor. I had to breathe through a tube and retrain my body how to, because a lot of times when you find yourself not breathing, you panic, and that makes it worse. My body still ached. I ended up having COPD because the first time I used to run up the stairs like a jog, not a run. But all of a sudden, after going up like 2 flights of stairs, I'm like, what is going on?
At a certain time in the morning, 3:30, something like that, hard to go back to sleep by 5 or 4. A lot of runny nose, like I said, and that phlegm still seemed like it's just sitting there in the back of my throat. And when I cough and I would talk, it'd be feeling like it's dry, but when it come out, it's like almost brownish. It's not green or white.
We're looking at the persistence of symptoms. So really the time zero is when were you at your baseline, right? So if you come in and say, you know what, a month ago I was able to do X, Y, and Z. Now I'm having, I'm tired all the time. We're gonna check all the things to make sure, if there's medical reasons for that. And if not, then, we're seeing the same constellation of symptoms, and so it's easy to kind of put them all together. So even if you had not had an official diagnosis, but you have these persistent symptoms of, and I could just name some of the more common ones: fatigue, brain fog, difficulty concentrating, palpitations, shortness of breath, with very minimal exertion. The point that I want to make is that if you're having symptoms that are lingering, that just are not getting better, right, and they're persistent, you should get it evaluated.
Sometimes you just feel like I'm by myself because you don't have anyone to share the story with, or to say, did you feel like that? Do you feel this way after you had COVID? And a lot of people look at you like, I ain't never had it. So it's like you sort of feel alone, and at the same time don't want to voice it to your boss or your coworkers, because they're like, if you lose weight and you eat right and you eat different, but then when you do all that and you still feeling the same way, it's like no one has your back in saying, that could be long COVID.
So there are now so many support groups out there for people who are, dealing with long COVID. So it's, again, the sense that people don't have to, suffer in silence, right? And we know that our communities are being disproportionately impacted. So it's really about, supporting people, getting them through this, and then hopefully, getting to the point where we can have treatments that can, one, help, but then more importantly, prevent this from happening.